John is Senior Director for Information Security at a large healthcare institution. What do you consider to be the biggest challenge with which you have to contend when it comes to cybersecurity?
Oh boy. I would say eh, what's a challenge is really understanding obviously we're, a hospital like Andy mentioned earlier, but we have a lot of other initiatives from a research and other operations that take place at the hospital. So it's really understanding all the different applications, processes, partnerships, and all that data, and what's really, making sure you understand what's the most critical data and processes so that those are getting the most attention from a data protection, security, classification, and that way you can also focus your, if a breach occurs or a security incident occurs where your network's compromised, you can respond and make sure you're prioritizing what's most critical to the hospital.
You deal with a broad spectrum of devices, from hospital devices, the Internet of Medical Things, to personal devices, patient and staff devices, smartphones, tablets, etc., that they bring in. And every one of these presents a potential security risk or security hole, if you will. How do you manage such a diverse device portfolio?
Yeah, to your point, I think we try to group those different devices, and trust me, we're not perfect, and I think all of healthcare is struggling. But what we're trying to do is, from a bring your own device standpoint, we try to limit really what those devices can connect to, both from a network resources and a PHI, patient data standpoint. On the medical devices standpoint, what we're trying to do is really understand what that footprint is in our organization. I think any large entity is going to probably struggle to tell you exactly what is running in their environment at any given point. And so what we're trying to do through initiatives like segmentation, in terms of taking those devices and really limiting what they can connect to and what services they can connect to within the infrastructure of the hospital. It's not, yeah, it's definitely not an overnight
Yeah,
trivial
but
initiative.
we went through this long period where about every 2 months there was some hospital in the news with some unencrypted laptop got stolen, right? You saw that over and over and over again, and you go, really? People aren't encrypting their laptops? And of course, we had long since crossed that bridge, and I feel like maybe people finally got the message because I haven't heard one of those stories in a while. But there are all kinds of architectures to help with this. Like for instance, I've got access to our EMR on my phone, but none of the data resides on my phone. It's just a viewer, So someone, I've got to encrypt my phone as well for other reasons, but it's if someone steals it, there's no way they're getting patient data off it.
Hospitals have such a wide range of medical device vendors with whom they deal. Ultimately, the hospital is responsible for all the security problems that occur, whether they're due to their own making or due to those of the vendors. Managing all those outside sources for potential risks must be a daunting task.
Yeah, and that's where you really try to go under the auspice of least privilege and limiting what data, what resources those third parties can get to. You could invest in a huge team to review every vendor's security posture, every partner's security posture, and waste a lot of time and cycles doing that. But what you got to try to do is a high level review of their risk coming into the organization, and then try to put the controls in place on your side to really limit what they can do, and review their access, review how long their maybe network connectivity should be there. Just really trying to tighten those controls than where maybe 10 years ago where those controls were. In a lot of cases, some organizations may set up those third parties just like an employee, and you really got to differentiate that so you're reducing that risk to your environment.